The resurgence of measles has become a growing concern in Canada and the United States. Hundreds of cases have been reported across New York and British Columbia in recent months. New York City is taking action today after seeing one of the largest outbreaks of measles in decades. Today, officials there declared a public health emergency and ordered that vaccinations be mandatory for certain communities. Here to explain is our Megan Batchelor. Megan.
Well, Carol, this is a drastic move for what officials are calling a drastic situation. 300 cases of measles in New York City, and they're hoping that this drastic move will perhaps stop the spread of this highly contagious virus. So here's a look at the area that's affected. It's in Williamsburg, which is outside of Brooklyn. There are 4 zip codes that are affected, and so those living in those zip codes must get the measles, mumps, rubella vaccine. The outbreak has mainly been confined to the Orthodox Jewish community there, and anyone found to have not received the vaccine will be fined $1,000 US. The mayor and the health commissioner in New York City declared this emergency today and made this announcement saying that this is the worst outbreak there since 1991.
There are almost 300 cases already, overwhelmingly in Brooklyn. And to give you a sense of what troubling development this is, it's a huge spike. We saw only 2 cases in New York City in 2017. So we have a very serious situation on our hands.
And to show just how serious that situation, here's a closer look at those numbers. There are currently 228 cases of the measles in Williamsburg itself, 300 in New York general, and 465 cases in the United States as a part of the outbreak happening there. There have been no confirmed deaths in New York so far as a result of measles, but this is a very serious virus, and it carries the symptoms such as that rash that you see in the videos. There's red eye, fever, cough, and it is highly contagious. People living in this area that's affected in Williamsburg are conflicted on whether or not this is the right move.
Rabbis all say they recommend the vaccination.
Well, my rabbi said otherwise, and I will not name him.
What's the basis for saying no to vaccinations?
Oh, I could go on and on and on. I don't know if I have all the time. Just like I said now, that preventative measures are not a reason to inject toxins into my child's body.
I think the people should be, more informed about this outbreak. Because the more they're informed, the more they're likely to go get vaccinated, They need to put out more information and let them know, what could happen if they don't get vaccinated.
Now, as far as enforcement goes, health authorities in New York will be in contact with those who have been in contact with people who have contracted measles and will be asking for their immunization records. If they have been found to have not had that vaccine, they will get that $1,000 fine.
Right, and the concern here is not only for the individual children, but also for the community at large, herd immunity. Measles have made a comeback in Canada, especially in BC. What's being done here to control the outbreak, Megan?
Yeah, the majority of cases in Canada are in BC. So far, there has not been any mandatory vaccinations ordered in the province of BC, or in any province for that matter. In BC, though, they've launched this check-in program where they are going to have public health nurses going to BC schools starting this month and administering the vaccine for children who have not had it. And this is leading up to the mandatory reporting that's going to be implemented this fall. It's similar to programs that we're seeing already in Ontario and in New Brunswick, where parents have to show immunization records at the beginning of the school year to prove that their child does in fact have that vaccine. Of the 28 cases so far in Canada, 23 of those are in BC. Other provinces seeing cases include Ontario, Quebec, the Northwest Territories, and Alberta. In Ottawa, there were 2 new cases reported last week. One of those cases is a woman who has cancer, and she was surprised to get the measles because she was vaccinated for it. But public health authorities do say that you are at risk of then contracting measles, even if you have the vaccine, because her immune system is compromised. CBC News has agreed to conceal her identity because she is afraid of receiving online harassment.
As the days have gone by, I'm quite angry that I must have bumped into somebody who wasn't vaccinated, but it's so preventable. it's something that nobody has to get anymore, and it's something that we shouldn't get anymore, you know?
The Public Health Agency of Canada says that it is up to each provincial government to decide whether or not they want to have mandatory vaccinations in place. At this point, no province has decided to do that yet. Carol?
All right, Megan, thank you. So just to reiterate, immunization's not mandatory in Canada. However, in Ontario and New Brunswick, proof of immunization is required for children to attend school. In light of these growing measles outbreaks, we're asking, should vaccinations for infectious diseases be made compulsory? Should provinces, all of them, require children to have that proof of vaccination before they go to school? And what about giving authorities the power to impose fines on those who refuse to get vaccinated? $1,000 in New York City. Joining me from Ottawa tonight is Pam Palmater. Pam is the chair in Indigenous Governance at Ryerson University. From Toronto, Sean Speer. He's a senior fellow with the Macdonald-Laurier Institute and author and freelance columnist Michael Coren. Pam, let me start with you, because the numbers among Indigenous communities for vaccination is very low, especially in the north compared to the south. I mean, how do you feel about vaccinations being made compulsory in Canada?
Well, I think they should be. I mean, we know generally that vaccinations have practically doubled the lifespan of human beings and have really reduced the amount of unnecessary blindness, illness, and deaths in not just children and people with compromised immune systems, but adults as well. And if you look at First Nations or Inuit communities who already have discriminatory underfunding, lack of access to health care, they have higher rates of chronic diseases and infectious illnesses. They already have compromised immune systems. And I think that vaccinations should be part of preventing any more unnecessary infectious diseases.
All right, Sean, what do you think? Should vaccinations be compulsory?
I think on balance, I would say yes. But Carol, that's not an easy answer for me. What this is involving grappling with the tensions of, in some cases, freedom of religion versus, say, public health or the public interest. These are the types of questions that in a pluralistic society we need to grapple with. And I think in this particular case, particularly in light of the evidence provided at the beginning of our the discussion here about, I think, rising cases, the highest rate of measles in the past 5 years, for instance. I think these are the types of reasons, I think, why, on balance, I think mandatory vaccinations is the right thing to do.
Okay, and Michael, what do you think?
Well, it's a very layered question. If something is compulsory, it doesn't mean that people will actually agree to it. And you can threaten to fine, but when it comes to a child and a parental regard for a child, they can still say no, particularly in communities such as the ultra-Orthodox one in Williamsburg in New York. There are two levels of opposition to vaccination. And I think there is generally a consensus amongst thinking people that, particularly when it comes to measles, not everything. I mean, very few people would say the flu shot should be compulsory. But when it comes to measles, yes, people should receive it. But the opposition to it, and it is minimal, but the opposition is based on either ignorance or ideology. And ignorance, when people simply don't know enough and they think, well, it's a waste of time. But ideology comes in various forms, both secular and religious. It's grown in the secular world. People have a sort of a new age ideology. They read unfiltered, allegedly medical news online and say that these could be dangerous. And of course, I think most of us are aware of the alleged link, completely fictitious, between vaccination and autism, which caused enormous damage.
But the problem there was that was in a high-level journal that a lot of people trusted, and then later it was debunked.
Yes,
fully
it was,
debunked.
and that's the only example I can find where a serious journal, I think in the UK, did publish this material, and it was based on completely false research, and that man has of course now been punished for it.
Yep.
But there is a great deal of popular internet wisdom that somehow vaccination is wrong. But I think that the bigger issue, and one where we're going to see an incredible number of, I suppose, case law being produced, is when it comes to religion, and it's in particular Christian and Jewish fundamentalism. I mean, the vast majority of Christians and Jewish people say, of course, we must vaccinate. But we do see this in some communities. It's going to be incredibly difficult in New York to go into a very insular, ultra-Orthodox community, large families. It's already rather autonomous and separate from mainstream, certainly mainstream Judaism and mainstream culture, and so your children have to be vaccinated. And what happens when
it's not only that, Michael. I spoke with a family doctor in the last few weeks who said that, you know, very few people who are worried and put off having their children vaccinated are anti-vaxxers. They're simply just worried and looking for more information in what they feel to be a confusing time.
I think that is the center of this issue, because I've read quite a lot today where people are very patronizing. Actually, they have contempt for those who don't receive vaccinations for their children. That's not the way to handle this. There must be education. There will always be a hardcore who say no, but if we educate and empathize with enough people, I think the vast majority will realize why this is essential. But it has brought out some rather anti-religious, rather bigoted comments about people who should know better. That's not the way to deal with this.
What do you mean?
I'm not going to allege anti-Semitism. I don't think that's the issue. But these people they live in the past. They live in the Middle Ages. They don't understand that their ideas are backwards. Well, that's not going to convince anyone. No one is convinced to act better because they're being abused.
And I would just add to that, Carol, that these are not simple questions. In a pluralistic society with great diversity, these are the types of issues that we're going to continue to grapple with. How do we balance competing rights? How do we balance fundamental issues like religious freedom with the broader public interest? In a way, Bill C-21, the Quebec government's secularization bill that's been the subject of great controversy, is an example, for better or for worse, of these types of tensions spilling out in the public domain. And I think we're going to see more of it, not less. And as Michael says, we're going to have to engage in these types of public debates in good faith, with respect. And I'm afraid that when on these types of issues, we see, as Michael says, a tendency towards superficiality and oftentimes a condescension and even worse. And I think that's not how, as a society, we're going to deal with what are, as I said, complicated and nuanced public questions.
But if you're entering the phase of and Pam will get you to respond to this, if you're entering the phase of a public health crisis where we don't have herd immunity, as I said before, where the community at large is in danger, I mean, what do you do?
Yeah, exactly. And think about it. I mean, it's important to have debate. It's important to have public education. It's important to talk about these issues. However, when we're talking about a potential public health crisis that could cost lives, we don't necessarily have the time for the years of academic debate to have around these things. You have to have a balance, and I think a balance on all things. A balance in terms of the response that's needed now in the interim versus, a longer-term response. And it's one thing if someone for religious reasons says, for me personally, I don't want anesthetic or I don't want a blood transfusion, because the person that you're potentially harming physically, maybe not spiritually, is that one person. But it's quite another when you make a decision that has the huge potential to not just only hurt yourself but other people. But when you travel to other countries who don't have access to health care or who suffer from impoverished conditions, you risk having a massive health crisis. And so it's more than just about public school. It's also about public transportation. It's about international travel. And it's our responsibility as human beings to making sure that this doesn't get worse and then come back, double fold back to us.
The issue we're talking about, though, is in a lot of cases is children. And so the punishment will befall the children, not the fine, but keeping them out of school, for example. Is that the way to go? Should all provinces in this country say to parents, if you cannot prove that your child was vaccinated, you cannot come into this school?
Well, if I may, this is not about years of academic debate. I don't think that's what Sean and I suggested. It's about simply being empathetic and sensitive now, not tomorrow, now, with certain communities that are resistant to vaccination. We raised 4 children in Ontario. I can still remember the little yellow, I think it was yellow, either the children or the dog, I can't remember which one, but for the vaccinations that sounded terrible, it was meant to be, that you had to have done. And yes, they couldn't attend school, but that leads to another issue. So the sort of families who may be resistant to vaccination, for example, let's say it's a Christian fundamentalist community or family, and that's relatively typical of those who resist vaccination. They won't get them done. They're not accepted in a public school. They're going to a private Christian school. That school is investigated. There are consequences here. I still believe all of these children should be vaccinated.
Yeah.
I just want us to approach this in a very gentle way. Otherwise, we cause division where it doesn't need to take place.
Just to be clear, though, do you think they should be allowed to go to school?
No, I really don't,
No.
because what we've seen, it used to be said, well, okay, that child may be ill, but everyone else is okay. We've now seen time and time again, if your immune system is weak, if you just have a different makeup physiologically, you can be infected. And it's when another person is harmed, that's when it has to stop.
But then what if people say, okay, we keep our children at home, Sean?
Well, I think, as I said, this is a complicated question. I think on balance, a mandatory regime makes sense, and those families will have to deal with the consequence if they choose to break or diverge from that type of regime. But make no mistake, these are the types of questions we're going to have to grapple with more, not less, as our population becomes more heterogeneous. I mentioned earlier Bill C-21, the bill before the Quebec legislature. Last year, or the past couple of years, we had the Trinity Western decision involving its law school and whether the university could impose or have a expectation of its students on issues of gay rights. We're going to have to deal with these issues. This is life in a pluralistic, heterogeneous society, and I think Michael's call for dispassion and goodwill is going to be essential. Just last week, I read a book, Carol, by American scholar Arthur Brooks called Love Your Enemies. I think that's a message that we're going to have to bring to bear as we deal with issues that aren't easy.
What does that mean to love your enemies? How does it relate to this case?
Well, I think it's essential that as we grapple with these tensions between, in this particular case, religious freedom and broader public health, we're going to have to do it in a way that is a way, as Michael says, that's rooted in empathy, not hostility.
But in the final analysis, because when it comes to civil rights and the clash between fundamentalism and mainstream society, we can talk about that a great deal. But the basic right to health is as fundamental as it gets. And in the end, as much as I'm calling for empathy, I do think it should be compulsory, and I don't want to imagine what it will be like when a child is vaccinated against the wishes of the parents.
Well, that's what it is. At the end of the day, are you actually going to hold a child down and vaccinate them against their parents' will?
It lasts for a couple of seconds. There's very little pain involved. We have case law on this when children have been denied blood transfusion. The parents have said no to a blood transfusion or to an amputation, all sorts of things. And the state has time after time in various nations said no, society has a right to protect the life of the child. They do triumph over the religious views of the parents.
And at the end of the day, there are lots of issues that are competing values or competing rights and ideologies. This is, a competing right or ideology versus the potential for a massive public health crisis. And so you're going beyond just the competing rights and the balancing of those rights, and you're talking about a national public safety issue, which takes a higher precedence when you're looking at just the basic right to life of other individuals. We all have rights, but it can't be such that it interferes with the right for someone else to live. And I think that's what makes this issue a little different than all of the other issues that have been raised.
All right, Pam Palmater, Sean Spear, Michael Koren, thank you for a very interesting discussion on this tonight.
Thank you.
Thank you.